Tennis elbow is a medical condition which is, down to its basics, a tendinitis. The muscles that raise the wrist and raise the fingers down at the wrist and hand are these cord-like structures. And they have an attachment that's not a cord-like structure, but it's a cuff-like structure, like this. And it starts about there and it works its way down to there. And that's where these muscles hook. Well, tennis elbow is a tendinitis of those tendons where they hook to the arm bone. A person will come to me that's been on a trip and they've had, say, a briefcase, and they're walking in a crowded city and they're moving their briefcase repeatedly to avoid bumping into people, will come back with tendinitis there. People that are doing a lot of twisting work and a lot of hammering work, these types of things, will develop these symptoms. Without doubt, conservative treatment is the treatment of choice and is all that is needed in the great majority of cases. Every effort should be made to keep this a non-surgical condition. The idea being that it is an inflammation, an inflammatory process, and not that something is ruptured. I saw a patient yesterday, a new patient with, actually was an old patient, but with a new problem, and it was tennis elbow. And he's not a tennis player. And he doesn't know what brought on the tennis elbow. I put him into a splint that holds the wrist in a slightly raised position. This causes a relaxation of the entire tendon, muscle, tendon complex, and it relaxes this. And I use a prescription of 24 hours a day, 7 days a week, except for bathing. They can use over-the-counter anti-inflammatory or pain medication like Advil or aspirin or Aleve or Tylenol. And they can take it off when they bathe, and if they go in swimming, they can take it off. It's about 95 to 98% successful. And then we'll find a very small group of patients who just aren't getting better. It's resistant to treatment. And in those cases where we've been treating somebody for several months and they're really not much better, and they've had the splints and the medicines and all we've talked about, then cortisone injections right at the site of the greatest tenderness are helpful. Conservative treatment is so very successful.